Welcome to the treatment group for panic disorder. My name is James Johnson, and I'm representing Alana Dresdan, Alana Dresdan. Alana is a 35-year-old female who fits within two differential diagnosis groups. One of them being panic disorder, and the second one being specific phobia. Now, with specific phobia, we can rule out that specific phobia because she does not meet the criteria for letter E, which is that she has not had experienced these symptoms of panic attacks over a period of 6 months. And we can rule out letter G is because she has not been diagnosed with any other mental disorder. We can rule out panic disorder due to the fact that she meets all the criteria in this, and that she has been experiencing sudden and unexpected panic attacks, which she has not had any concerns. She has had concerns for future panic attacks. Although she did not experience any further attacks for a couple weeks, she became increasingly fearful about driving. She became anxious when she thought about driving and experienced another attack one day when she tried to drive to work. At this point is when she decided to seek out help with a doctor and to have help from him. Alana is a 35-year-old mother. She's a single mother and attorney who recently passed the bar exam. She moved to a new city with a well-established firm that specializes in special and corporate law. Over the last few months, she has been feeling a significant amount of stress related to studying and taking the bar exam, moving, buying a house, and beginning a new job, and making school and after-school care arrangements for a 9-year-old daughter. This appears to be a stressful situation for her moving into a new town. Her physician suggested that she might experience stress attacks and advised Alana to try to learn stress reduction techniques. She tried to use these stress techniques, but they did not work for her. So she went to see a psychiatrist, and she was prescribed some anti-anxiety medication. Client's multi-axis diagnosis is within axis 1 is panic disorder, axis 2 is none, axis 3 is none, axis 4 is numerous stressors related to recent moves, new job, and being a single mother, and axis 5 is her gap is at 70. This client theoretic perspectives is behavior perspective. The client's symptoms may be due to faulty learning experience. She may have learned association between stressors in her life and her involuntary anxiety reactions. Therefore, this client has been classically conditioned. This client has also been operating conditioned. She avoids driving her car because when she does, she feels anxious and sometimes has a panic attack. She also fits within the biological perspective. The client's symptoms may be due to an overactivated sympathetic nervous system, and the client may have a deficiency of GABA sensors and the access of norepinephrine that result in the client's panic attacks. According to anxiety sensitivity theory, the client may be hypersensitive to problems within breathing when she is present in the multiple stressors. And this might also be a genetic predisposition. There's not been any sign of any family members having any panic disorder, but this cannot be ruled out. She also fits within the cognitive perspective. The client's panic systems may be due to misinterpretation of environmental stressors as being threatening, thereby triggering anxiety symptoms. This is Alana Dresdan, age 35, single mother, has a lot of difficulties adapting to her new environment, and has become a little stressful within her life story. My name is James Johnson, and thank you for your time.